Hi, I'm Marit Medefind Bond. I am the Certified Diabetes Care and Education Specialist at Golden Valley Health Centers. I work at the women's clinics in Merced. I'm a registered nurse and I'm also board certified in advanced diabetes management. So I, in particular, see patients who have pre-existing type 1 or 2 diabetes in pregnancy or who have gestational diabetes during their pregnancy. So I grew up in Merced. I went to Golden Valley High School. I went to Harvard University for my undergraduate degree in history of science, and then I attended nursing school at Johns Hopkins University in Baltimore, where I got a master's in nursing. Prior to working with Golden Valley Health Centers, I worked at a variety of inpatient and outpatient roles in like general medicine and also specifically related to childhood cancer and also diabetes care as well. So I'm passionate about working in diabetes care because I myself live with diabetes. I was diagnosed with type 1 diabetes when I was 2 years old, and I have a strong family history of diabetes, both type 1 and type 2 on both sides of my family. So this is something very near and dear to my heart, and my experiences have led me to want to really help people living with diabetes live their lives successfully and fully. So patients should come see me if they have pre-existing type 1 or type 2 diabetes and are planning pregnancy, or if they are newly pregnant with pre-existing diabetes, or when they get a diagnosis of gestational diabetes. So I will help them manage their blood sugars during their pregnancy through a combination of changes to their diet, their activity, and possibly medication as well. Everyone should be screened for diabetes at age 35. So even if you are not pregnant, it's really important once you hit age 35 to be following up regularly with your primary care provider for regular screening for prediabetes and diabetes. There are certain risk factors that increase risk for prediabetes and diabetes as well, so definitely be in communication with your doctor about when you should start your screening, because sometimes it might be earlier than 35 as well. So common questions patients ask me often have to do with how diabetes is going to affect their lives, right? There's a lot of concern about, well, is this something I'm going to have to deal with forever? How is it going to affect my future? And when they're pregnant, how is this going to affect my baby and the health of my pregnancy? Which are all fantastic questions. So those are things we really dive into more in depth and in detail during visits at the office. So usually the providers will refer a patient to me if they have elevated blood sugars on lab work or if their glucose tolerance test in pregnancy comes back a little bit higher than we expect. At a first visit with me, I'll expect to talk to you about changes to diet, activity, and lifestyle that can help improve blood sugar management during pregnancy. We also might do some lab work like an A1C, which shows us an average of your blood sugar over the past couple of months. And or just checking your blood sugar in clinic. We'll show you how to do this at home as well, so you have the tools you need to successfully manage your blood sugars at home. Depending on what's going on with blood sugars, we may end up starting medication right away. There's several different medications that we use in pregnancy to manage blood sugars, so I do teaching for all of the medication management as well, and then I'll help you adjust your medication doses during your pregnancy to successfully manage blood sugars. Good girl, thank you. So this is Prim. She is my diabetes alert dog, and she helps keep me safe at work with managing my own diabetes while I'm helping my patients. We've been paired together for about, I think, 8 years now, and she's just a wonderful support and an additional tool for me in managing my diabetes. She doesn't directly interact with patients, but my patients really enjoy seeing her when they come to visit me. So she alerts me on a daily basis. Whenever I have a low or high blood sugar, she will let me know, again, by just tapping me with her paw, just like that. So for anyone looking to receive treatment, I would just strongly encourage you to reach out to your provider sooner rather than later. We are here to help you. Diabetes is not something you manage alone. It takes a team, it takes a village, and we're here to support you, right? Diabetes can be very challenging because it takes a lot of work. Ins and outs of daily management can be challenging and frustrating for people. So please, please continue to follow up with your primary care provider or your diabetes specialist. Even when things get challenging, right? During those challenging times is a great moment to connect with your provider team so they can provide you support and successfully managing your diabetes.